a product made in CHO cells that you couldn't make with this technology?
No. So anything you can make in CHO cell, you can make in here. Because the CHO cells are making antibodies.
Okay.
And once you get an antibody sequence, we can make full-length ones, we can make single-chain antibodies. We've shown we can make all of those.
Okay. So now that you would have to transfer that to the manufacturing stage now that you think you've got the technology to where you've proven it, you've actually shown in mice that you can get the therapeutic effect. And now to get this into manufacturing, to actual technology, what do you have to do?
Probably go get a new target. Okay. Because drug companies will never reinvent the same drug again. They've already sunk huge amounts of cost into making an anti-CD22 with a toxin on, so they're not going to make another one that's a little better. Okay?
Yeah.
So what we're going to have to do now is sit down with oncologists and say, so the reason we made this one, rather than go make a new one, because there's a lot of cancers that are untreated, either because they're too small a patient numbers that the big drug companies haven't gone after them, or because they're just difficult to make a protein against. And we thought about, maybe we should go make one of those, a brand new, and show that we can make a drug nobody else made. But the problem with that is if you go make one of those, even if it works, then the pharma industry kind of says, well, how do we know that this doesn't work just because you picked that target? So the reason we picked CD22 is because it was in clinical trials. So we wanted to do a head-to-head, apples-to-apples comparison. So we could say, look, here's in the literature how these drugs in clinical trials work. Here's how ours work. Now the pharma industry, NIH, they can look at this and go, okay, yours works just as good, right?
And then they can say, why not manufacture this way?
Yeah, but when they manufacture it, it won't be, let's make a duplicate of one that's already out there. It's like, okay, we see that your drug works just as good. We see that you can manufacture much cheaper. Now let's go and look at all the other ones that we might make. So that'll be next generation. That'll be what we do. And personally, for me, I want to make dog anti-cancer antibodies.
Because?
So there is nothing that you have to do in a human, right, if you want to make a human drug, that you don't have to go through a dog model anyway. Dogs have the exact same cancers we have. But no one will make an anti-cancer antibody for a dog because no one would pay $10,000 or $100,000. But if we could make one for a dog, and we really can make it as cheap as we think we can, now instead of being $50,000 or $100,000, we think we can get this down to a few $1,000s and maybe even cheaper. Now you have something which dogs would buy for their humans would buy for their pets, right? The dogs won't buy.
That would be within a cost that a lot of people just might decide to pay.
Exactly, right? I have an old Bernese Mountain Dog, right? Okay. So I have her in at the vet a couple weeks ago because she's developed she has now a high squeaky voice, and it turns out when she barks it's really high, and it turns out it's something that Bernese Mountain Dogs get when they get old. So it's nothing to worry about, and there's no treatment for it. It's just like, no, it's called pharyngeal paralysis. Their pharynx starts to just get paralyzed as it gets old. So it makes so she barks like a little dog. It's kind of funny. She's an enormous dog with a high. But anyway, I had her in there, and I'm waiting in the waiting room just to talk to the MD, and there's a guy sitting next to me with this beautiful Labrador, right? Nice little female lab, about 5 years old. And he says, yeah, unfortunately, she's got cancer, and I just can't afford the treatment. You can get chemotherapy for dogs.
Yes,
but it's about $6,000, and all it does is slow the tumors down. It doesn't really cure them. Yeah. And I'm thinking, you know what? This is a cure. This isn't, give a chemotherapy and slow down the tumor. We have a chance to really cure these things.
So just in the process that you would need to take a drug to humans, you can